You specifically said the age of this lovely actress was 42 years. Okay. Now, if at the age of 42, statistically speaking, the most common cause of a sudden cardiac death is lack of blood supply to the heart. So, most people who die at the age of 40 to 50 of a sudden cardiac death, most of them, 70 to 80% of them, will have coronary artery disease. First kind of sign of anything which is not quite right. For example, you may get a little short of breath. Nothing that bothers you a lot, but just a little short of breath. Or you may get some palpitations in your heart. We see younger and younger people, getting heart attacks. Okay. Many of them have catastrophic heart attacks, which causes immense damage to the heart muscle. And some of them even unfortunately pass away. Smoking is another very big risk factor. A lot of young people take to smoking or they chew tobacco, and that becomes a double whammy. So if you have the metabolic syndrome and you smoke or you chew tobacco, it's a recipe for a disaster.
A lot of times when it's an actor or a model who passes away due to cardiac arrest, there are so many articles and research articles that are taken out that blame them going to the gym, working out and taking steroids or protein powder
while they are straining to lift those massive amounts of weights that many of them lift. Okay, and that is the cause of the heart attack.
Okay, firstly, thank you so much, sir, for doing this. Welcome to the Free Press Journal. How have you been?
I have been very well, and thank you for inviting me to speak to you.
You're most welcome. Sir, of course, last night we heard a very sad news of an actress, Shefali Jariwala. She passed away due to cardiac arrest at the age of 42. And it was quite shocking for everyone, considering she was extremely healthy, extremely active, used to, have a very healthy lifestyle. As somebody who's been in the field of, cardiology for so many years, how do you see these things as, somebody who's young and active suddenly passing away due to cardiac arrest?
Well, in order to understand what we are talking about and trying to set the terms of reference of the question that you asked me, we have to try and understand what one means by a sudden cardiac death. Okay. And the definition of a sudden cardiac death is death caused by malfunction of the heart,
Yeah.
which occurs within 1 hour of the manifestations of some symptoms. Okay. So, if, for example, the person experiences a little shortness of breath, or a little chest discomfort, or a little palpitations, and shortly thereafter, within 1 hour, the patient passes away, that is considered to be sudden cardiac death. Okay. Now, one can ask, why is it that the why is it that the heart suddenly stops beating or suddenly stops functioning? If you have to understand that, you have to really understand what makes the heart such an important organ. Okay. All of us understand that the heart is a pump.
Yeah.
Okay. It pumps blood to all the parts of the body, and therefore the body is able to survive because it gets enough blood supply, enough nutrition. Now, what powers this pump? Every pump, including the pump in your air conditioner or your refrigerator, is powered by electricity. So there is inbuilt electricity which sends the signal to the muscle, which is the compressor. And this
Okay.
electrical signal goes to the compressor, the muscle, which then pumps and beats and pushes blood. Okay. So if your heart stops working suddenly, then the problem could be either with the electricity or with the muscle.
Oh.
Okay. So when somebody like this at the age of 42, who is otherwise healthy, suddenly has a cardiac arrest or a sudden cardiac death, one has to ask the question, which one of these two factors are responsible for the malfunction of the heart? Now, talking in general terms, okay, you specifically said the age of this lovely actress was 42 years. Okay. Now, if at the age of 42, statistically speaking, the most common cause of a sudden cardiac death is lack of blood supply to the heart. Okay, what we call ischemic heart disease,
Okay.
or it is also called coronary artery disease. So the pipes that carry blood to the heart are narrowed by a
Mm.
process called atherosclerosis. And this narrowing ultimately leads to a sudden stoppage of blood supply to some part of the heart. And that some part of the heart then cannot function properly. Okay. And the heart efficacy as a pump goes down, and the blood supply to the rest of the body starts suffering. So, most people who die at the age of 40 to 50 of a sudden cardiac death, most of them, 70 to 80% of them, will have coronary artery disease. Okay. Now, there are other conditions which can lead to a similar problem.
Mm.
For example, the person may have a defect in the structure of the heart. Now, what do I mean by that? For example, one of the valves may be narrow.
Okay.
So the narrowing of the valve does not allow the heart to pump efficiently. Okay. And then suddenly one fine day, if the person is exercising or whatever, the blood cannot be pushed out of the heart, and the person may get a sudden cardiac death because of that. There are other defects as well, certain kinds of diseases of the muscle, which can also do something very similar. Okay. So one really has to investigate these kind of patients and find out which one was responsible for it. Of course, if the person has passed away, there's no fun in investigating that that person because the person is no longer alive.
Yeah.
But there's a very important thing. Many of these conditions, other than the narrowing of the heart arteries, which we call atherosclerosis, many of them are hereditary. You can pass them on to your children. So, if you know that you have a particular kind of disorder of the heart muscle or of the heart electrical conduction system, you may pass on this disorder to your children.
Okay.
And if the diagnosis is made, then certain preventive steps, etc., can be taken to prevent the sudden cardiac death of the person's children. Okay. It's a huge subject. I mean, one
Hmm.
can go on talking about this for hours and hours and hours. Okay. But I think the message is that I would like the general population to know is that at the first kind of sign of anything which is not quite right, for example, you may get a little short of breath.
Hmm.
Nothing that bothers you a lot, but just a little short of breath. Or you may get some palpitations in your heart. Okay. Or you may start feeling tired, which normally you never felt tired.
Mm.
These are all warning signs that something may not be right with your heart. And therefore, it's well worth a check with the doctor, who would do, of course, the necessary investigations and decide whether there's something that is very seriously wrong with you, and whether something like a sudden catastrophe could happen. So it's necessary to visit your doctor if you have these kind of symptoms. Okay.
Okay. Also, do you see a change in how, like earlier when we were growing up, we always heard this thing that heart attack only happens after the age of 50 or 55, or, it's not that common. But these days, it's become very common even in younger ages. Do you also see this shift?
Oh, absolutely. We see this shift a lot nowadays. We see younger and younger people, getting heart attacks. Okay. Many of them have catastrophic heart attacks, which causes immense damage to the heart muscle. And some of them even unfortunately pass away. Yes. Now, there are multiple reasons for that, but basically, I think the unhealthy lifestyle that has percolated through the population at large is responsible for that. As you are aware, and most of the people who will be watching this program are aware, that obesity and overweight is a major issue.
Yeah.
Okay, so what does that do? It alters the entire metabolism of your heart, of your body, and because of that, there are so many deleterious changes that occur in the blood vessels that supply the heart, the brain, etc. And that causes the hardening of the arteries or atherosclerosis, which ultimately leads to a heart attack or a stroke in the brain. Okay. And we see this all the time. So the message is, have a healthy lifestyle, maintain body weight, eat a healthy diet, eat lots of fruit, nuts, vegetables, white meat, fish, that kind of a diet. What we used to call in the days gone by the Mediterranean diet, you know, where you don't have too much of the oily stuff and too much of very high calorie stuff, because the high calorie and the oily stuff will make you put on weight, and then you'll spiral into what in medical terms is called the metabolic syndrome, which means overweight, so you have too much, too big a tummy, too big a little diabetes, high cholesterol, high triglycerides, high blood pressure. So all of this is a consequence of, to put it in simple terms, overnutrition, too much of food going into the body
Body.
and not enough exercise to burn the calories that you consume. Okay.
Yeah.
So we see it all the time. And smoking is another very big risk factor. A lot of young people take to smoking, or they chew tobacco, and that becomes a double whammy. So if you have the metabolic syndrome and you smoke or you chew tobacco, it's a recipe for a disaster. Sooner or later, you're going to end up with one or more complications of blood vessels, and God forbid, you may end up with a massive heart attack or a stroke. So yes,
Okay.
we see it all the time.
Also, there are just so many videos right now on the internet that say that, that 40, 45 minutes before you have a heart attack, you feel restless and you're out of breath, you feel uneasy, and you must either take a tablet, and there are a lot of medicines that are named, you should keep it in your drawer side. Are all those things actually practical, and what is the number one precaution you can take?
Well, as I said in the beginning of my chat with you, that at the first sign of any such symptom, uneasiness, shortness of breath, palpitation, chest discomfort, please don't take any medicines because you might do more harm than good. Okay. Go to the nearest doctor, go to the nearest hospital where an immediate evaluation of your heart function can be done. And the commonest, of course, test is an ECG, which is very easily available. And there are other blood tests that may also be ordered by the doctor to see whether there is anything going wrong with your heart. Okay. So if these two things are normal, the chances of you having a heart attack or some catastrophe waiting to happen is very, very, very small. Okay. So don't try to self medicate.
Yeah.
Okay. And the common misconception is if they feel a little uneasy in the chest or a little bit of bloating in the abdomen, they pass it off as gas. You know,
Yeah.
this is all because of indigestion. This is dyspepsia. This is gas, and then they'll find people taking a lot of antacids and all kinds of other things like Fudinhara and all these other medications that are so popular. But if it is gas, okay, you're lucky. But it may not be gas, and you
Yeah.
wasted precious time by doing all these, home remedies to try and feel better. It would be much better for you, much safer for you, and more profitable for you if, with these kind of symptoms, which you can't really understand or explain, go to the nearest doctor, go to the nearest hospital, and let them do the basic checks and find out if there is anything going wrong with your heart. Because if you reach early,
Mm.
you can prevent a major heart attack. You can save your life.
Yeah.
There is something called a golden hour, you know, the concept of a golden hour. If you can restore blood supply to the heart, the blood supply which has stopped because of a block in the circulation, if you can restore blood supply to that blocked artery within 1 hour, okay, you can salvage or save a large amount of the heart muscle from dying completely and from not being able to recover after that. So that golden hour is so crucial. So the message is any symptom in and around the chest and upper abdomen or upper tummy as we call it colloquially, go to a doctor, let him decide whether there is something going wrong with you or not. Please don't take that decision by yourself.
Got it. That's actually a great advice. But lastly, before I end this chat, I would also like to add this point that a lot of times when it's an actor or a model who passes away due to cardiac arrest, there are so many articles and research articles that are taken out that blame them going to the gym, working out, and taking steroids or protein powder a lot. Do you think that also has something to do with such things?
I do think so. And let me explain to you why. Okay. This syndrome of wanting to pump iron and build muscle, okay, is different from just going to the gym to exercise and be fit. There are
Mm.
two types of exercises, okay. One is the regular, what we call cardio fitness exercise, which is walking, jogging, skipping, okay, doing the ellipticals in if you go to a gym,
Mm.
okay. Those are cardio exercises. They build up stamina, they help you to lose weight, okay. They improve your blood profile, your blood biochemistry improves, okay. And you train your heart to work better. So, in other words, you make certain that your system of the circulatory system is working optimally. Okay. Your blood pressure, when you're doing these kind of exercises, treadmill, cycling, etc., doesn't shoot very high. Okay. It does go up, and it should go up because you need to supply more blood, but there's no catastrophic rise in the blood pressure.
Mm.
On the other hand, these people who want to build muscle, they take these protein supplements to help the muscle to be bigger and bigger,
Yeah.
and many of them, if not all, start lifting very heavy weights. They do bench presses and they do power lifts and a whole lot of other exercises, right? Now, whenever they do that, the kind of exercise that they are actually doing is called in medical terminology an isometric exercise. Okay. Now, the difference between an isometric exercise and the cardio fitness exercise is that the muscle in isometric exercises does not shorten too much. Okay. And because it doesn't shorten and it stays in that shortened position for a long time, the blood pressure goes very, very, very high. Okay, it shoots up. It may even touch 200, 220, 230 while they are straining to lift those, massive amounts of weights that many of them lift. Okay. And that is the cause of the heart attack because the blood pressure suddenly shoots up and that causes damage to the pipe carrying blood or the artery, and the artery inside lining of the artery splits, and because it splits, then there is a clot which forms in that split portion of the artery, and that clot blocks the blood supply, and then you end up with a massive heart attack. So I'm all for exercise.
Yeah.
Okay, and I think it's a wonderful thing to do. The cardio fitness exercise is the way to go. But if you do need a little bit of muscle strengthening exercises, please don't go whole hog and try to build muscle. You know, 10, 15 kilos of dumbbells and other things is more than enough to keep your muscles in good shape. Okay, and it will certainly not uh, be responsible for any kind of heart attack that may come in future. Okay.
Okay, great. Thank you so much for the insightful chat. I'm sure a lot of people watching this will get a better idea on all the suggestions, advices that you've given.
No, thank you so much, and thank you so much for inviting me. Okay,
You're
I
most
really
welcome.
appreciate that invitation. Okay,
Thank you so much, sir. Thank you.
most welcome, and you stay well. Okay,
You too. Take care, sir. Bye-bye.
thank you, thank you. Bye bye.